Imagine yourself settling into bed this evening, shutting your eyes just as you have on countless occasions, and then never opening them again. No advance notice, no recalled discomfort, simply eternal quiet. This scenario unfolds much more frequently than most individuals comprehend. Annually, hundreds of thousands of people aged 50 and above experience heart attacks and strokes during their slumber. And here's the truly alarming aspect. For the majority of these cases, the root cause wasn't an uncommon illness, misfortune, or solely hereditary factors. It stemmed from a routine they followed each night, assuming it posed no threat. In the upcoming moments, I'll reveal the evening behaviors that subtly transform rest into one of the riskiest periods for your cardiovascular and cerebral health. Moreover, I'll demonstrate adjustments you can implement right away to substantially lower that danger. The information you're about to receive isn't hype. It isn't scaremongering. It's grounded in actual medical facts. I'm Dr. Charles Bennett, and I've dedicated many years to researching heart health in those over 50. If you fall into that demographic, this could genuinely preserve your existence. Here's a fact that escapes many. The night hours are when your heart and blood vessels are most susceptible. Data from the American Heart Association indicates that almost 50% of deadly heart-related incidents in seniors happen between 1 a.m. and 6 a.m. This isn't random. While asleep, your system is meant to switch to a safeguarding state. Your blood pressure decreases naturally. Your pulse decelerates. Your autonomic nervous system transitions to restoration. Your mind eliminates harmful waste accumulated from daytime activities. However, when specific routines disrupt these innate mechanisms, sleep turns into a hazardous biological territory. This evening, you'll discover the reasons behind frequent nocturnal heart attacks and strokes, the riskiest evening practices post-50, and an uncomplicated regimen that safeguards your heart and brain during rest. All that I'll describe is based on authentic scientific studies presented in an applicable manner. Let's start with the initial lethal evening practice, consuming food late and in large quantities. Numerous folks don't view this as perilous. They believe it's merely supper. But past 50, the timing and content of your nighttime meal can dictate if your heart relaxes or labors extensively. When you partake in a substantial meal later in the night, particularly after 8 or 9 p.m., multiple hazardous events occur simultaneously. Your gut requires more blood circulation. Your heart has to exert more effort to deliver to your digestive organs. Your blood pressure elevates rather than declining. Your metabolic rate accelerates when it ought to be winding down for slumber. Put simply, you're compelling your heart to operate extra at the precise time it requires downtime the most. A significant research effort in the European Heart Journal tracked more than 100,000 grown-ups over multiple years. The findings were straightforward and unsettling. Individuals who habitually dined late faced a markedly elevated chance of heart attacks and strokes at night versus those who ate sooner. Why does this occur? Delayed digestion elevates blood triglycerides. It heightens inflammation in arteries. It interferes with the typical nocturnal blood pressure reduction. And there's an additional peril that most overlook. Retiring with a packed stomach boosts acid reflux. Acid reflux isn't merely inconvenient. It may activate the vagus nerve and provoke hazardous irregularities in heart rhythm, particularly among seniors. I once cared for a 68-year-old individual who'd consumed hefty late suppers for many years. One evening, she endured a heart attack while asleep. Her heart had endured persistent nocturnal strain for ages, and that night, it ultimately failed. The positive side is this. Amending this behavior yields prompt advantages. Opting for earlier, less heavy meals permits your heart to genuinely recuperate overnight. Blood pressure normalizes. The likelihood of nighttime incidents plummets significantly. Now, let's proceed to the second lethal evening practice, one that plenty underestimate: omitting medications or administering them incorrectly timed. If you're on drugs for hypertension, high cholesterol, or anticoagulation, this section is vital. Blood pressure adheres to an inherent daily cycle. In fit people, it diminishes during rest. But in numerous over 50s, this decline fails to occur, or alarmingly, it surges nocturnally. This nocturnal high blood pressure is profoundly risky. Extensive research in The Lancet demonstrates that correctly scheduled meds can slash the risk of heart attacks and strokes at night by almost 50%. Yet, forgetting doses or using meds sporadically permits hidden blood pressure surges while sleeping. These surges can break apart fatty deposits in vessels. They can generate thrombi that migrate to the heart or brain, and they frequently attack sans any alert. Indications. I've managed patients who neglected their meds multiple evenings weekly. One experienced a severe stroke overnight. He lived but with lasting immobility. Med timing isn't trivial. It's a question of survival. Always consult med schedules with your physician and avoid omissions. Now, let's address the third lethal evening practice. Among the most overlooked assassins in those over 50, undiagnosed or unmanaged sleep apnea. Sleep apnea leads to recurrent breathing halts during rest, occasionally enduring 10, 20, or 30 seconds. Each halt reduces blood oxygen. Each reduction initiates a crisis reaction. Your heart accelerates. Your blood pressure jumps. Adrenaline-like hormones surge. This might transpire hundreds of times nightly, often sans recollection. Vast university studies reveal that ignored sleep apnea multiplies nighttime heart attack risk threefold and stroke risk fourfold. Indicators encompass persistent loud snoring, awakening choking for breath, AM head pains, severe daytime weariness, hard-to-manage hypertension. One patient of mine considered snoring merely bothersome. One night, her oxygen plummeted so drastically that her heartbeat grew erratic. She endured because aid came promptly. Therapy transformed her existence. Side sleeping aids, but it's no replacement for accurate assessment. And as hazardous as these practices are, the following is even more prevalent since many seniors adopt it deliberately, thinking it's beneficial. That's where the genuine peril commences. Now, let's advance to the fourth lethal evening practice, one that numerous seniors choose on purpose, assuming it secures their rest, retiring dehydrated. Past 50, thirst perception weakens. Many also curb evening water to prevent nocturnal bathroom trips. Superficially, this appears sensible. In truth, it's immensely dangerous. During slumber, your body persists in losing moisture via respiration and sweat. If you commence rest dehydrated, your blood system starts the night disadvantaged. Here's the internal process. Dehydration thickens blood. Thicker blood circulates sluggishly. Sluggish blood clots readily. Now merge this with nocturnal biology. In sleep, your pulse inherently slows, blood pressure falls. If blood is viscous concurrently, flow to heart and brain may diminish perilously. This explains why dehydration markedly heightens ischemic stroke and nighttime heart attack risks. Research in the Journal of Cardiovascular Disease indicated that moderate dehydration boosted nighttime heart event risks by over 60%. I recall a 70-year-old who boasted of no post-dinner water. One dawn, he had a sleep stroke. Scans displayed a thrombus obstructing a brain vessel. His blood was abnormally dense. Dehydration was pivotal. The fix isn't complex. Consume a water glass 1-2 hours pre-bed. Use facilities immediately before reclining. Have water bedside and sip minimally if thirsty awake. This easy practice maintains smooth blood flow all night, easing heart and brain burden. Now, let's examine the fifth lethal evening practice, one scarcely linked to heart attacks and strokes, resting in an overly warm or chilly room. Bedroom temp directly impacts your heart system in sleep. If too hot, your body fights to dispel surplus heat. Vessels expand, pulse rises, fluids escape via perspiration. This amplifies heart stress and elevates pressure. Harvard studies showed rooms over 24 degrees to 75 degrees notably hike nocturnal heart risks. But severe cold is equally perilous. Cold narrows vessels. This boosts resistance, compelling harder heart pumping. In seniors with rigid arteries, this might trigger final heart attack or stroke. European stats show nocturnal heart attack spikes in cold periods. especially seniors. Optimal sleep temp is 18 to 22 degrees, 65 to 72 degrees. Herein, pulse stabilizes, pressure control enhances, sleep deepens restoratively. Temp management isn't luxury, it's heart defense. Now you grasp these 5 lethal practices, here's something mightier. A step-by-step protective evening regimen to begin tonight. A heart-secure nocturnal routine. 7 p.m. consume light supper. Emphasize lean proteins, veggies, digestible carbs, shun heavy fats, big servings, excess sodium. 7 p.m. drink water glass. If doc prescribed nocturnal meds, take as instructed. 8 p.m. partake in serene pursuits, mild strolls, books, soft tunes. Evade emotional turmoil, bright displays. 9 p.m. ready sleep space, set room temp, bedside water, lower lights. 9:30 p.m. lavatory stop, fully void bladder, dental hygiene, final meds if ordered. 10 p.m. position counts. If snoring or apnea suspected, side sleep with neck aid. If nocturnal awake, rise gradually, sit prior standing, sip water sparingly if required. This regimen cuts nocturnal heart stress by over 40% per various circadian pressure and sleep security studies. Quick recap of 5 silent sleep killers. 1. Late hefty suppers. 2. Omitting or mistiming meds. 3. Unmanaged apnea. 4. Dehydrated bedtime. 5. Inadequate room temp regulation. Individually risky. Combined, a catastrophe. The reality hurts, but empowers. Many nocturnal heart attacks and strokes aren't destiny. They're avoidable. No costly therapies needed. No drastic changes. Just knowledge and steadiness. If over 50, this night counts. Alter habits now, not later. Your heart served you long. Guard it resting. Before departing, 4 key requests. First, channel subscribe. Weekly, I deliver vital health tips clearly for over 50s. Second, video like. It spreads this to unaware risks. Third, comment. Type, I'm changing this tonight. Your pledge might motivate another. Finally, share video with loved one. Spouse, elder, pal. You might safeguard a life unknowingly. Sleep ought to mend, not injure. Seize control now. This is Dr. Charles Bennett. See you soon.